certainly sobering. When your child gets sick, there might not be a room for them at the hospital. That's the harsh reality doctors at UNC Children's have been dealing with now for months. WRAL's health reporter Grace Haba takes us inside the pediatric ICU to show how respiratory virus season has only made matters worse.
As respiratory illnesses continue to spread in our area, it's led to some of the youngest North Carolinians struggling to breathe and ending up here seeking care at UNC Children's Hospital.
Our beds are always full.
Caring for an increase in patients has kept the pediatric ICU
we have an NG2
busy.
At one point, we had 9 patients awaiting beds in a 12-bed ED. So 75% of our available capacity to see patients was limited by the fact that we were just awaiting beds.
And without those beds available, it means fewer patients from other facilities are being transferred. And now some elective surgeries are being postponed.
Certainly there are emergency procedures that need to be done that we can't delay. And so those move forward. As procedures get delayed, some procedures that are semi-elective become less elective, become more urgent, and then turn into emergent.
Across the board, wait times have grown. Some now waiting hours to be seen, then waiting hours more to move rooms.
Hours count, minutes count, right? Here in the ICU the other day, we had patients, in the adult ED and the pediatric ED needing emergent care, and we were deploying our entire staff to those areas. And so it's been quite a challenge, and it's been pretty brutal.
While there are still kids getting sick with COVID, doctors say most of their cases are being caused by the flu, RSV, and rhinovirus. Dr. Benny Joyner says he is hopeful RSV has peaked for this season, but says the drop in cases hasn't been enough just yet to make a difference at the hospital level.
My hope is that as we enter the spring, there will be a little bit more of a familiar springtime lull in pediatrics, but I'm not going to keep my fingers crossed because it hasn't been the case because we still have all the other things that we need to do for patients.
Doctors say if your child is not feeling well, keep them home from school to help mitigate the spread of these respiratory viruses and to help reduce the number of patients they have walking through these doors. In Chapel Hill, Grace Haba, WRAL News.
Oh, how frustrating for families. So to help reduce wait times, doctors suggest maybe going to your primary care physician or to an urgent care for any non-emergency issues.